battle is over the agency's decision to double the fluoride level in our drinking water. Target 7's Roberta Baskin first reported on fluoride hazards last year when the EPA was thinking about increasing its standard. Now that it has, Roberta has a report on the internal controversy that move has caused. Roberta?
Paul, the controversy has already gone from the conference room to the courtroom. EPA scientists say the new fluoride standard is too much of a good thing. Too much fluoride can discolor teeth and do much more serious damage. That fact has led the Natural Resources Defense Council to sue the EPA. And the EPA's own scientists are heading into court to back the lawsuit.
We don't want EPA hiding behind a cloak of authority and saying, trust me, when there isn't any reason to. Well, in this case, we just can't mislead people about a threat to their health because it undermines confidence in this whole place.
Dr. Robert Carton leads the Union of Scientists, Engineers, and Lawyers at the EPA, who say the EPA's decision to double fluoride levels can cause crippling bone diseases, also dental fluorosis. At the new level, up to 40% of children could develop damaged teeth. That's what happened to this young girl's teeth, and it happened at the levels now in effect. In severe cases, the teeth actually crumble and wear away. Both the dental community and the federal government argue it's a cosmetic problem.
It's a balance between dental decay prevention and increasing incidence of dental fluorosis. Dental fluorosis in its extreme forms is not very aesthetic. It's not desirable.
The Natural Resources Defense Council is arguing in court it's more than undesirable. It can be extremely harmful.
They're supposed to say anything that may have an adverse effect on health has to be protected against. And Congress is very clear about that. Don't just protect against things that you know will harm people. Protect against things that might. Because if you don't, and it turns out 20 years later you were wrong and should have, a lot of people are sick who didn't have to be.
Those most likely to get sick are people with kidney problems and diabetics because they drink a lot of water and retain the fluoride. And children accumulate the most fluoride. For better or for worse, fluoride works in our teeth when we are young. So why has the EPA raised fluoride levels to a point where its own scientists say it could be harmful? Well, critics say it's the result of pressure from states who would otherwise have to spend money defluoridating their water, and pressure from the medical community. It supports all fluoridation.
The work we're doing is scientific, which means really we don't have any standing here. The work that we do actually means nothing because it can be changed by the whim of someone who wants a certain political outcome.
Dr. Carton has written numerous letters to EPA Administrator Lee Thomas trying to stop the decision.
We've tried, I don't know how many times, to bring up problems and point them out and try to get some kind of response. And unfortunately, we've had to go to the trouble of going to court to bring out the facts. And now somebody's going to have to listen.
The court may not have to listen if the EPA gets its way. Late yesterday, the EPA went to court to stop its scientists from being allowed to participate. Ironically, when fluoride levels are at half the new limit, water suppliers are required to warn consumers. So in that case, if you have children under 9 years old and you're worried about dental fluorosis, the EPA says find another water supply. Now, how high your fluoride levels are really depends on where you live. In the Washington area, naturally occurring fluoride levels are low, and so fluoride is actually added to the water. And tomorrow night, Paul and Dan, we will be looking at water contaminants, and we'll have some disturbing results on that.
Okay, you talked about the Natural Resources Defense Council. That's a, what, consumer group?
That's a consumer environmental group that is very heavily involved in drinking water issues, and they're the ones who have gone into court on this.
Okay, Roberta, we'll look forward to your report tomorrow. Thank you very much.